Before I dive into what my bill does, I think it's important to speak to why it's so critical. There is a healthcare shortage in Missouri. Every county in the state, except for 3 counties, are considered healthcare deserts. During COVID, Governor Parson waived several restrictions for APRNs, and there were no reported issues during that period. Unfortunately, the waivers have expired and the restrictions are back. You may hear from witnesses that the sky is falling if this bill passes. But the truth of the matter is 27 states have passed transition to practice and they have not repealed the laws. Collaborative practice is also very expensive. A survey from Mona indicated that paying a physician can cost up to $50,000 plus per year. And you'll hear from some witnesses who can speak in detail. What my bill does, 179, it is a great solution for our constituents who need access to health care, and it removes unnecessary barriers. It does 2 things: transition to practice after 2,000 documented hours with a collaborating physician. It also allows APRNs to prescribe Schedule II medications for behavioral health patients. We made some changes for Schedule II with hospice patients, and this expands it to behavioral health because we have a mental health crisis here in the state. While I believe APRNs should have full practice authority, transition to practice is a good compromise. 27 states plus Washington, D.C. have granted full practice. Missouri is one of the most restrictive states in the country for nurse practitioners. And where I come from, in Kansas, across from where I represent, they have full practice authority, and many nurse practitioners are moving across the state line or deciding to move across or work across the state line versus here in Missouri. APRNs are highly trained and have clinical experience. Research shows that they have consistently demonstrated to provide safe, effective, patient-centered, efficient, and evidence-based care. So,
all right, thank you, Senator.
Take over.
Thank you.
Before we ask any questions, go ahead. We'll ask questions combined when Senator Schroer gets done. So
I appreciate it. Thank you, Mr. Chair, members of the committee. For the record, State Senator Nick Schroer from the 2nd and St. Charles County, presenting Senate Bill 144, which seeks to reform regulations concerning advanced practice registered nurses. Senator Lewis said APRNs within the state of Missouri. This transition to practice bill brings our healthcare system into the modern day, empowering nurse practitioners, highly experienced medical professionals, to practice to their fullest extent of their education, their training, and their abilities. This legislation phases out archaic regulations which the majority of other states have already repealed, which has statistically been shown to increase patient access, increase patient outcomes, decrease healthcare costs by simply letting these providers treat Missourians exactly how they've been trained to. You'll hear that many states, like Arizona to Oregon, where full practice authority has been passed, led to fewer preventable hospital admissions and better management of chronic diseases. In Missouri, where a total of 109 out of the 114 counties face horrendous primary care shortages, again, that's 109 out of 114, this legislation has been proven to provide more experienced face-to-face care from providers who know their patients and the issues that they are experiencing. Senate Bill 144 isn't just a run-of-the-mill regulatory reform. It is a lifeline for the state that ranks in the basement at number 42 of 50 in overall healthcare. Our physician shortage of 3,700 physicians in the next 5 years will be countered by tapping into the experience and skill set of our trained nurse practitioners, just as we have seen in the majority of other states across this nation. Finally, from rural Missouri to the urban corridor, Missourians will have access to affordable, accessible, timely health care in the state of Missouri. For those reasons, I urge you to prioritize the health care and the future of your constituents by voting yes on these 2 bills.